My name is Emily Ho. I am the new director of the Moore Family Center. I'm very excited. This is the first ever co-sponsored Moore Family Center seminar as part of our college seminar series. A couple quick announcements for the students. So there are several programs represented here today. So the public health students, a reminder that you're going to be meeting in Mile 19 after the seminar for discussions. Nutrition and exercise sport science students, I have two separate sign-outs that I'll distribute now. You guys can pass those around, so please make sure you sign those before you leave. So today we have a researcher that I know quite well, Dr. Jackie Shannon from OHSU. Jackie and I actually have several joint projects together related to cancer prevention and prostate cancer. She's not going to talk about that at all today. So, I've known her for quite some time. It's one of these serendipitous things where she had a student happen to call my office saying she needed to take a nutrition class. And we started chatting about, we actually care about the same things. And from that, we've established some really close collaborations. We have 3 grants together, program projects, R1 and R21. So it's a really great merging of skills. I like to measure stuff, and she can work with people. So So Jackie has a really diverse background. She did her training in nutrition at Penn State. She also has an MPH and a degree in epidemiology from University of Minnesota, MPH, and University of North Carolina. After her doctoral training, she went to Texas to work as an epidemiologist. Yes. And then in 2000, she came to the Northwest and is now an associate professor in
public health preventive medicine.
At OHSU. She also is a scientist at CROET, and again, she also worked closely with many OHSU investigators related to clinical trials and cancer prevention. But what she's going to talk to you today about is this fabulous program that she has relative to outreach and community engagement. And it's called Get Healthy, and it's a really fun program, so you'll really enjoy this.
Hi. What a great crowd. This looks great. Thanks to all of you for coming. This is really fun. So I hate to do this, but I'm going to start off with an apology. It's always a bad way to start a presentation, right? But my apology is that Monday is the beginning of Thanksgiving break, and my husband and I, in our ultimate wisdom, decided that we would leave Friday afternoon to go to see his parents in Texas, and so planned our plane tickets out of Portland at 4 o'clock. So I'm getting a drive-by at 1 o'clock. My kids and my husband are driving by. If I miss that car, I'm here for Thanksgiving. So I will. I'm hoping to wrap up. Emily's going to stand up and help me out at 12:45. But I'm hoping if you have questions, feel free to interrupt in the middle of the presentation. But I will be dashing out right at 12:50. So I really do apologize. This is a program that I absolutely love talking about. It's one of the most fun presentations I get to do. So I have a tendency to babble on and on and on about it. But please, if you have questions, just anytime throughout, please interrupt me. It has absolutely nothing to do with my working in prostate cancer clinical trials, but this has been really fun. So the program I'm going to talk to you about is called Let's Get Healthy. And what I want to give is an overview of how we ended up with this program. So where it started, kind of the evolution, because it's got a little bit of an unusual evolution, and then what it is now. So to be a little cliche, in the beginning, there was Body Worlds 3, and I don't know any of you went to Portland when Body Worlds 3 came there. This was in 2007, and if you're not familiar at all with Body Worlds 3, it's the plastinated humans, and they had this wonderful exhibit of the plastinated bodies. And OMSI, to bring this exhibit there, partnered with OHSU and said, if you'll give some money to help pay for this exhibit, we would like to have investigators from your different departments set up little exhibits at the end of the Body Worlds area so that when people are coming out of Body Worlds, they pass by these OHSU exhibits and learn about something with health. So OHSU said, well, this is a good idea. And an investigator there said, well, maybe NIH can pay for a little bit of this. And NIH said, well, we'll dump in a tiny bit of money if you agree that as part of this, you do a couple things. You inform the public about research. This is a big concern at the National Institute of Health, that the people really don't understand what is research. They're afraid of research. So he said, we want you to use this as an opportunity to inform the public about research and try to provide some personalized health information. And then I added the in a fun and accessible manner. So this was put before us, and it was put before the entire institution, and the Cancer Institute said, oh, we can do that, and they took their usual posters. And other programs said, oh, we can do that, and they took their usual posters. And I said, I want to do something really fun. Let's take this really seriously. What can we do? And I worked together with a colleague, John Purnell, who's in endocrinology, who's very interested in obesity and was looking at genetic markers related to obesity. And we started thinking, and I said, I want to teach them about nutrition and body composition. And he said, well, I want to look at try and get salivary samples and look at markers for obesity. And I thought, well, how can we turn this into a research study? And so we kind of tossed around a number of different ideas. And what came up was the wristband. And all this did was we thought, in the hospital, we get these little wristbands, and they've got codes on them, and that identifies everybody. Well, what if we used a wristband and we just put a barcode on there, and then we could have people come through and do different things. They could learn about their diet. They could give a salivary sample. They could do whatever. But they would be participating in research because when they scan their barcode, everything they do goes into a data set, a population data set. They become an individual observation in a database. So they get to learn about themselves, and they get to participate in research. So this was our grand idea. So the way it looked was we developed this. Our goal was to provide the public with personalized health information while providing the opportunity to become research participants and learn about research. And we put together a bunch of different modules. We had a diet assessment station. So this is our little diet assessment station here. And we used a validated food frequency, short little screener that talked about fruit and vegetable intake and fat and fiber intake. And people would go through and they'd complete it, and then they'd get tailored feedback. And then we had a body composition station where people would come in and get behind a screen, and they'd have their height measured, and they'd have their waist circumference, and they'd stand on a Tanita scale and measure their percent body fat, and that would go into the database. They would go to the blood chemistry station where we partnered with OHSU Pharmacy, and they'd have little finger prick, and they'd get their HDL cholesterol, their LDL, their total cholesterol, their blood glucose, and this would go all into the database. So all of these pieces are getting linked together. And then if they wanted, they could go over here to the salivary sample station, and they'd take a little bit of scope and they'd swish it around in their mouth. We'd label the scope tube and they'd spit it back out. And we had an anonymous salivary sample that was linked to body composition data, diet assessment data, and blood chemistry. And at each of these, every time somebody would go through and complete a survey, they'd get some sort of personalized information back from this. So all we knew about them was what they completed here, and we knew their gender, their race, ethnicity, and their age. So their tailored feedback would be tailored based on those 3 variables. So this is what we put together. We thought this was really interesting. Being good academicians, John and I figured, well, this should take care of our service activities for the next couple years. We're good for promotion and tenure now, right? So that we lasted about a week. We were there, and it was hugely popular. And Amzi said, can you come back for another week? Because people are really, really liking this. So they absolutely loved it. And we were jam-packed. There was not a time that we were there that we didn't have everything single station filled, and people waiting in lines, people coming through with their 3-year-old screaming in the cart and saying, I just have one more station to finish. I really don't want to mess up your research. Can I go and feed him and then come back? Would that be okay? And you're like, yeah, that'd be great. But they really enjoyed this. So we were there for, I believe it was 9 days total, and we had almost 3,000 people came through what we called at the time Nutrition World. The general age distribution, it sat right around the middle, so between 25 and 55 was the vast majority of the people that came through, but there was a pretty wide age range here. I think our oldest individual was 92 that came through. We had individuals in wheelchairs, we had all sorts. We had a pretty reasonable race distribution. This pretty much reflects Portland as a whole. And it was about 1/3 male and 2/3 female. So we were pretty excited. We were pretty happy with this, and we were done. We didn't really think it was going to be a whole lot past this. This was our 2-week endeavor. But what next? Well, this had gotten out there, and a lot of people had seen this. and we kept getting requests. And they would kind of come to the university through different routes, and then they'd kind of trickle down to me. And we'd have requests from schools, from teachers that had been through, and said, you know, I'd love to have this, come to the school to teach the kids about some of this information and engage them in research. Can you do something at the schools? And we had requests from community groups. So the African American Health Coalition, they wanted us to come to their wellness fair. The Hispanic Health Fair wanted us. The National Public Health Week, we were invited to come and do a display there. And there were additional requests. Anytime something special happened at OMSI would call and say, hey, that thing that you do, could you come and do that again? Well, this became pretty overwhelming because every time we'd get one of these requests, we'd have to haul the computers out of the closet, try and get them set up again. They wouldn't work quite right. Get them out there and then put them all back in the closet. It was all run by my staff on volunteer time. So it was pretty overwhelming, but the requests kept coming. So in 2009, so that was back in 2007, 2008. In 2009, there was a new opportunity. So the ERA supplements, are people familiar with these supplements that came through where we decided to put this big bolus of money into research, and there were a lot of supplemental grant awards that were being given out in relation to existing grants. And two supplement opportunities came up that people approached us about. One was in relation to an existing program. It's called a Science Education Partnership Award. And OHSU was holding a Science Education Partnership Award at that time that was called the Teacher Institute for the Experience of Science, or TIES. And the principal investigator for the TIES program approached us and said, there's a supplement available to the TIES program, and I'm wondering if you'd be willing to write a supplement to change your program somewhat, but allow it to go out to schools. And I thought, well, that would be really interesting. So we wrote a supplement for several $100,000 saying, you know, we're going to modify our program. We're going to make it so it can be accessible to schools, and we're going to work with teachers. And then another opportunity came through our Clinical Translational Science Association community, the community program within that. And they had it was a 2-year grant for a larger sum of money, but that was specifically to partner with a community organization. And so we thought, well, maybe we can partner with OMSI to make this thing a little bit better. Maybe make it a little more hands-on and fun and exciting. And then we'll make it miniature so that we can take it out to rural communities. So we don't have to have such a huge amount of stuff to truck around. We'll kind of make little miniaturized, fun, OMSI-type exhibits and take it out to rural communities. So we wrote that application. And in the end, we were lucky enough to receive both of these so that we could take what we had done as Nutrition World and really make it something a lot better. So we revised our goals. I can't see it on here, but I can see it on here. So what we had initially said is here in black. We wanted to provide public with personalized information on their diet, body composition, blood chemistry. And now we say we want to look at other health measures as well while providing interactive education. So we want people to be engaging with us. And then we also still want them to learn about becoming a research participant. We now want to provide a queryable interactive database. So what made us a little different was that we were creating this population data set. Well, now we want to make this data set accessible to others, not just to me sitting at OHSU, but to the school teachers and the students and the community members so that they could learn about the information that we were collecting as well. We wanted to redesign Nutrition World so that it was web-based and easily implementable and transportable, so it could go other places. And we wanted to develop an infrastructure to support the use and expansion of the program. And so with this change, we also developed a new name. And our new name, with some help from the folks at OMSI, was Let's Get Healthy. Promptly after we developed this name, Michelle Obama came up with Let's Move, and I wrote her, and I said, you're behind. But we were there first. Can I get rid of the start at the bottom there? It's not wanting to move now. What did it do? Did I do that? There we go. Thanks. So with the new name came our new audience. So we switched from Nutrition World, we became Let's Get Healthy. I hired a programmer. We reprogrammed a lot of the materials and the different modules that we had so that we could be linked and interconnected across our different modules at the fairs. And we had our first school fair. This was terrifying. We decided we wanted to focus on middle school age population of children. We felt that that the materials we were presenting were conducive to middle school, that there wasn't nearly as much out there for middle school students as there was for high school students, and this was an opportunity for them to learn. So we focused in on the middle school students, and we held our first fair at the St. Helens Middle School, and this is really the middle school for that St. Helens School District. So I want to share with you a video that was made at that fair that we've changed pretty dramatically since then, but this gives you an idea of what we look like.
This is Let's Get Healthy. We're an education and research exhibit based out of Oregon Health and Science University. And what we do is we educate the public about their own health. So this is one of the events that we are having. This is based at a school. So the school's really interested in having kids learn about their own health, and then it opens to the community later that evening so that the public can learn as well.
Students have been very excited, talking about it in the hallways, and as they've learned from friends that got to come this morning, they've been excited to come this afternoon. If they had afternoon science classes, as they've been coming through with their science teachers.
And the kids, they love it. I mean, they're really excited. They're interested in playing on the computers a little bit. They're very excited about doing the body composition. It's been fun to listen to them talk. I was spying a little bit when one of the principals was talking to some of the kids about what they learned, and they were very excited to kind of see what was their body size like, and they were curious about their blood pressure and telling her about things that they were planning to change and what they were eating. So it's really fun, and they love to play the games, of course. Like
They get a health passport where they can have the different stations stamped. Some can't wait to do all of the different stations. Some of them aren't so excited. And some of them you get the range where they're not excited at all, but they actually want to do something. That's those kids that you want to get.
One of the things that's great for us as middle school educators is to have our students be exposed to other professionals. And I'd say that's one thing that I'm noticing today is as they're going around and talking with other adults and professionals, they're seeing how their education is important in the future and the potential careers that they could have as well. So that was something we maybe didn't anticipate, but I've noticed that being a real positive thing.
So far, they seem to have learned a lot about their own nutrition. They're kind of surprised sometimes that they need more of other stuff and lots of others. And when they've been checking the labels, they've been trying to get sodium and sugar content and fat, and they've been way off. Some of the stuff that says that it's real healthy turns out it's not. So, but yeah, there have been some eye-openers for them.
We're just lucky to have the opportunity and appreciate everyone coming today to help out.
So we did not give her that lollipop. That was AHEC. So that was our first school fair, and for us that was really a beta test of kind of this new model of what we were trying to develop. So what did we learn from St. Helens? Well, we took away a lot of lessons. We learned the value of volunteers. This was the first time that we'd gotten some community volunteers to help us out. We learned that we needed friendlier, more age-appropriate materials. We learned there was a lot of opportunities for partnerships, and you saw a number of our partners that were there with us. AHEC was there, the Portland Alcohol Research Center was there, and we realized that there was a huge opportunity for a number of different partners. And we realized that we needed to be flexible. We were going to be have different types of venues, materials, exhibits. We needed to have a very flexible system. So the value of volunteers, we really moved from this concept of volunteers to individual investigators. And so what we did when we first started this program, it literally was run by me collecting up whoever was on my staff who didn't have anything better to do on a Saturday to please come help at the fair. And recognizing very rapidly that if we're going to host a fair for a middle school of 500, my staff of 5 was not going to cut it. And so we began to think about how can we reach out to the community? How can we begin to bring them in as the volunteers that can help run this fair? So we opened up our volunteer opportunities. We developed a web-based online registration system, a WUFU system, where people can go on and they can volunteer for different portions of the fair. They can say, I'm really interested in volunteering for the body composition station. They can see the fairs that are upcoming and where we're holding them. and then they can indicate kind of their qualifications. So we get an entire list of people that are volunteering before we get out to the community. Then once we get there, we go through a training with them, and they actually do become individual investigators. And so they sign these individual investigator agreement forms. I take them through about a 45-minute in a face-to-face training in human subjects research protections so that they learn about human subjects research. And then they actually become investigators. So we've taken that message of what is research out to the volunteers as well as to the people participating in the fair. This has been an incredibly successful way of getting people to be engaged in the fair. So not only are, a small group saying, can you come out to our community, we're expanding it and saying, now, you want us, bring your community in to help us hold this fair so that when people are coming through, they see the faces they recognize. And then they also learn about doing research. Right now, we've gone from having 15 registered volunteers. At the time I did this slide, there was 317. I believe we have well over 400 registered volunteers. A lot of these people come back time after time. We've had people drive from Portland all the way over to Yakima because they want to volunteer at the Yakima Fair. And then we've had a lot of people that are just there in the town. At schools, it's great to have parent volunteers so they can see what we're doing. So this has been something that we realized very quickly after opening up at our first large school event. Friendlier and fun ways to learn. So first we wanted targeted interactive exhibits, and this was that engagement, the collaboration that we worked on with OMSI, where we worked with them to develop these little hands-on manipulables that mirror what they're being taught about during with the different modules. So we have a diet assessment station, and together with that, we have this thing here about learning about portion sizes. There's a thing that talks about energy in, energy out. And so they get to play these games. These are not data collecting. These are just games that they can engage with that reflect some of the data collection pieces. And then these are also available for loan without the full exhibit. So a lot of times we call it our lending library, and people say, well, I'm having a little event. I don't want to bring the whole Let's Get Healthy Fair, or more frequently, we don't have time to take the whole Let's Get Healthy Fair, but we can give them our lending library and say, take these 5 exhibits, take them to the school for the science night, and it gives kids a time to do some hands-on playing with these different little exhibits. Age-appropriate materials. So this was an aha that shouldn't have been an aha. This was our first, where we put body composition information. This came from the Center for the Study of Weight Regulation. It had, all the good CDC information on there. It talks about, what are the appropriate levels for different things. It's really bland and boring. And we used this at St. Helens, and the kids were like, toss it, Loaded with numbers. Lots of opportunity for judgment in here. What's your number? Where are you at? Are you obese or overweight? So we learned very quickly, not the best way to get the information. So we moved to our first little trial at this. We made it a little more fun, a little more exciting, gave kids an opportunity to write their stuff down if they wanted to. Still kept some numbers in here. These are the growth tables, the CDC growth tables. So it's got, the cut points for BMIs for boys and girls. Then we thought, let's keep working on this. And we took this over to our parent advisory board and our teacher advisory board. And we said, what do you think? And they said, nix the numbers, nix the labels. We don't want to tell them they're overweight and they're obese. Think about this a little bit more. So we had a couple different ideas, and we ended up taking it to our student focus group. And what we ended up with is, not sure if you can see it. Yeah, you can see it up here at the top, where they sort of rank themselves of how they're feeling about their body, and then there's a sliding scale for their body mass index. And when the person is working back with them and doing the height and the weight and the waist circumference and the percent body fat, they just show them on the scale, and we ask them not to write anything down. The kids can choose to write it down if they want to, but the volunteers themselves, all they do is they point on this little sliding scale down here, here's how you're doing. Opportunities for partnership. So really, we're trying to expand and formalize some of the partnerships that were existing and then add to these. We had the partnership with the Portland Alcohol Research Center. This is where you saw them with the little goggles on, the vision shift goggles. Kids really enjoy doing that, trying to see if they can hit the basketball hoop. We've partnered with the Methamphetamine Abuse Research Center. They have a number of games where they're looking at cognitive performance, and we've been partnering to be able to take what they're doing in those games and pull it into our data set. We're working with the Area Health Education Center, AHEC. Frequently, they just sort of come with us and they'll do different experiments for the kids, do some of their things in a box is what they have. And then we've partnered with OSU Extension, has been at a number of our fairs that have been out at, in the LeGrand Fair, OSU Extension came out there, and Madras OSU Extension has been out there as well. Scientists with specific research projects have partnered with us because they can actually use some of the data that we have, and then they can also add to the materials that the information that we're requesting. So we've partnered with scientists from orthopedics who are really interested in knee health, and they have a knee health survey. And so they've actually worked with us. They can do it in multiple different ways. They can just have their pen and paper questionnaire and have the kids have a wristband and write down the wristband number at the top and then fill out the questionnaire and do data entry. Or they can, take a little more time and build it all the way into our system where we actually program the questionnaire into our materials, and it's its own little module. And they collect the information. So scientists have kind of worked with us all the way across the spectrum, where either they just travel with us or they actually take what they're interested in collecting data on and make it a part of the Let's Get Healthy Fair. So we now have like a breast cancer module where we have a breast cancer researcher who's very interested in learning about accessibility to mammograms and women's understanding of screening and when is it appropriate to be screened. And she developed a whole survey that over probably 4 different series of interviews with focus groups, we've now managed to put into a computerized version that's kind of quick and easy to move through with sliding scales and maps and these different things. And then when people complete that survey, that actually, the information dumps into our database, so it's linked with everything else that individual goes through at the fair. And then we also have national partners from other science education partnership awards. We needed to build flexibility, so we realized that we weren't going to always have a nice school gymnasium or the OMSI. Some of our venues have been, indoor venues in places like Hermiston where we had no wireless access. In fact, our power cords fell out of the ceiling at one point. And we've had outdoor venues. Canby, there was a big fair for migrant workers, and it was all outside in the park. And so we needed to be able to modify our materials so that we could work in any of these types of settings. And one that I didn't show you there is we've actually gone to Washington, D.C. We represented at the Science and Engineering Festival, the Nation's Science and Engineering Festival. We were representing NCRR, or now the Office of the Director, at that festival. The first festival was held in... what do they call it? The National Grant. It's the big open mall area, the National Mall, right in the middle of D.C. And so needed to be able to modify our material so that we could function in the middle of a park there with thousands of people around. So our size and content can be varied. And now what we do is, we have people measure out how big of a space will we have, and we mock the whole thing up and do the full layout before we even walk in for the fair. Language and tailoring. So we've been trying to focus more on underserved populations, and that's mandated that we need to think about what is the language that's being used, and is this material being tailored in any way to different racial and ethnic groups, or as well as age and gender groups. So where we've really done a lot of work is with the language tailoring. An example here is in Madras. So we have everything is in Spanish, and in Madras, it turned out that about a third of the individuals took, or 20% of the individuals took the full fair entirely in Spanish. And this is just a representation of the distribution of the population in Madras. We also now have everything in Korean, Vietnamese, Mandarin, and Cantonese. So we've done 2 fairs with the Asian Health and Service Center, where pretty much the entire population coming through those fairs speaks one of those 4 languages and completes the fair and all the modules in one of these different languages. That's really fun. We have everything's color coded, so we know whether they're orange, blue, pink, or green. That's the different languages are based on the colors, so that we can get them the right materials. So as we've grown, we've really had to redesign our approach and how we're thinking about what Let's Get Healthy is, from being kind of just this almost health fair to really being an entire program. And within that program, there's a lot of behind-the-scene pieces that are going on that are allowing us to continue to grow and to contribute data and to engage in research. That goes from things like developing data and specimen request forms and data use forms, and developing a system for how people request data and how we maintain our data systems. We have our full volunteer recruitment and registration. We have the database development and management. That's been a huge piece where, we were really good at dumping large, vast quantities of data into a big, data repository system, but we were not very good at getting it out. And so now we have a number of individuals who their job, one person is the person who does the interface at the front, and then there's another person behind that who makes sure that the data is clean and can go into the repository, and then there's a third person who's really good at taking the data out of the repository, turning it into meaningful queries so that you, on the back end, can pull up an online site and say, I'm curious about what happened at Hermiston. I'm an individual who went through the fair at Hermiston. Tell me something about the distribution of obesity in my population. And they can run a little query there. We're not perfect yet, but we're working on that. So now there's that whole back-end piece that's being developed. Obviously, the biorepository development, that's where all the salivary samples are going. We actually have quite a number of linked salivary samples, and a whole system behind who gets to use them and how do they get to use them. So investigators coming and saying, I have a question about obesity and looking at genes at a population level related to X, the information that you might have. Materials and module development, that's the front end piece. That's the fun piece that everybody likes to do. But that actually is just one of these many pieces there now. So reaching beyond Oregon, just to give you an idea, this is where we've been so far in Oregon. The red dots, the red dots are requests that as of yet are unfulfilled, although I think a couple of these we've fulfilled now. The blue dots and the purple dots are where we have gone. So you can see this is Oregon, and then we've also been down here to Kansas, and I think I got pictures of those, and Washington, D.C. So this was the in 2010 and 2012, where we were at the National Science Education Foundation, or National Science Fair. And there were probably well over 5,000 individuals that came through these Washington fairs. So very huge fairs, and then very little fairs. We've been at Nicodemus, Kansas, which was the last remaining slave-founded town west of the Mississippi. West of the Mississippi? East of the Mississippi? Mississippi. West of the Mississippi. And this was definitely a smaller, but they have a reunion every year where families come back into the town, and they have a giant health fair, and they asked us to come out to Kansas and hold a Let's Get Healthy event. So how's the data used? It's really used by in a lot of different ways so far, and we're really hoping to expand this more. High school students have used this for their Intel Science Fair projects, and so they get the data. These individuals actually are using data. They're high school students, and they're using data from the middle schools that feed to their high school. So we were at the Westland-Wilsonville middle schools. We had fairs at all the 3 middle schools in the Westland-Wilsonville school district, and then the high school students in their stats class were able to have access to the middle school students' data, and then we're able to do I think these guys were looking at body composition and maybe fruit and vegetable intake. I can't remember exactly what their question was, but they were utilizing that data to learn to address a question. Graduate students have used the data for master's thesis. School districts as a whole. So the St. Helens Fair, one of the things they did was they actually came to us before the fair and they said, we're really interested in energy drink consumption among our kids. Can you add something to your fair that asks them about their energy drink consumption? And so we did. We asked 2 or 3 different questions together with the diet station, and then they got that information back to help them learn about, what's going on in their student population and then what kinds of changes they might want to consider making. Communities have used the data. Madras has used the data and one other community in actually developing proposals for submission to develop community programs because it gives them a nice little snapshot of the health in their community. Workplaces have begun to use the information, and then researchers. And these are little things that we've developed in a couple of the different stations where it's just talking about what's the big idea. And it gives, a little blurb about one particular investigator's project that they're interested in, that they're using the data that you're providing at that station to answer certain questions. So success by the numbers. This was us as Nutrition World in 2007, 2008. We had 4 fairs. Now we have, this is way behind, but we have well over 35 fairs that have been done. We've been all over the place. We've gone from having 4 stations to 8 full-time stations, plus 12 optional OMSI exhibits, plus 22 additional modules that are optional. The scope of the projects have grown dramatically. This is our volunteers down here, 350 plus registered. And we've gone from about 2,759 data points, observations, people, to well over 10,000 at this point in the data set. Things that we can offer for everyone. Right now we have the demographics, a diet assessment, body composition, sleep assessment, cancer risk, and evaluation station. For the kids, we also offer just blood pressure. We do pre-post evaluations in the school, so we have written evaluations that the kids do before the fair and after the fair. An example of when we've used this is when we were developing the skin cancer prevention module. We wanted to get an idea of, what did they learn when they went through that module? Did they retain anything? Did they, how many of them even went through the module? And so they complete these pre-post evaluations to talk about, that ask them questions about their own use of skin sunscreen and what do they know about, altitude and the effects of altitude on sun exposure and these kinds of things. And then we also offer lesson plans that we have a group of teachers come in the summertime for a 9-day teacher experience, and we ask them to develop lesson plans around particular topics within Let's Get Healthy. So they've developed a series of lesson plans that talk about body composition and percent body fat and what is it. They've developed a series of lesson plans that are on how do you use data. So how do you use data to make a point? So and these are social studies lesson plans, math lesson plans, science class uses them, so a whole series of them. We do have some on skin. Yeah.
I was wondering throughout whether you run into any problems pertaining to the fragility of science.
And how it's constantly changing.
Science is very controversial.
Mm-hmm.
I mean, we're always reading about how scientists disagree with each other.
Yeah.
And I think in the nutrition area, I don't know very much about the nutrition area. I think in the nutrition area, it is a particular problem where you have scientists who, in a sense, represent the more conservative view or liberal view, or certain scientists who are in the pay of
industry,
corporations, and they come up with this kind of result. So the data is in flux.
Yeah.
In flux. Yeah. So and now what you're doing is you're going out to the entire world. Mm-hmm. That's your plan. Go to the entire world with this information, which has a very solid scientific basis. But I don't know if it's there.
Yeah. So actually, you raise an excellent point. Most of the stations we currently have are based on what we would consider the most solid of the science. So, and it's even barely science at that point. Eat more fruits and vegetables. Fruits and vegetables are a healthy diet. Sleep assessment surveys that just categorize you as you're more of a morning person than an evening person. So we do very little that's linking behavior to disease, kind of endpoint things that would be a little more controversial in the science. Now, one place where we're really running into this, though, is we're now creating. We've been funded by the Moore Institute, actually, to create what's called an epigenetic module. So teaching kids about the science of epigenetics, and even more specifically fetal programming. Well, now that's a really, really tough one because that is a field that is constantly changing. And so we're at the very beginning of figuring out how are we going to engage kids and teach them about this. What do we even want to teach them about this? And that question of how are we going to work with this constantly changing field? And one of the approaches that we're actually taking is that the module itself may be an introduction to the fact that science changes. And here's the development, here is how science has changed, and here is how scientists have learned. So it actually gives, instead of giving the kids the answer, it demonstrates what is the process of science. And so one way we're doing that is looking at what we know about DNA and how has that changed over history, moving from very Mendelian to more of an epigenetics concept of DNA. So that absolutely does come up. And I think it's something we struggle with on a regular basis. The modules themselves don't so much use those scientific measures, but the people taking the questionnaires, they ask those questions constantly. And so it is, it's very much of a learning process. And part of that is raising an opportunity to help people understand the process of science. We have one of our pre-post evaluations, one of the first ones we did was in kids talking about science and, do you trust scientists? Do you believe in science kind of before and after the fair? The results are pretty interesting because some of them, after the fair, their belief in science actually went down a little bit because they were introduced to some things that they hadn't really thought of before as science. And they saw one of the things they saw was when we do a Tanita scale measure, we talk about what causes variability in percent body fat. So when is the measure not so good? And how much variability is there in a measure? And it could be because you're dehydrated. And so suddenly they're realizing that we're telling them this isn't always black and white. And so it's a very interesting point. And it's definitely one we're regularly thinking about. So this is kind of how we've grown and what we look like now. We're actually moving into using the fair as a tool for recruiting individuals into cohort studies. So it's a great method of getting baseline information on a large number of people very quickly. We've done this once at St. Charles Health System in Bend, where we were recruiting healthcare workers into a study of sleep. And so we put the fair on for a 24-hour period of time so that we could have, both day workers and night shift workers. And they came through and they completed their diet, their body composition, a measure of cognitive performance, so vigilance tasks, and a sleep assessment. And then they were enrolled in a year-long cohort study where we've been keeping contact with them over that year, every 3 months online, and then we'll have a follow-up fair. And we're about to start that same process again with another much larger cohort in Astoria. So how will we grow? We've got lots of ideas coming. We still want to continue to partner with others for outreach. There's a lot of other programs out there and a lot of things, and I don't want to recreate everything, but I love the idea of we make a nice base. We're very visible, and people like to come along with the fair because then they can link their information to other information. We want to build new modules. So that How Will We Grow is supposed to go away, but we're looking at a cardiopulmonary module where we're having kids measure heart rate and then do a Dance Dance Revolution kind of thing and then measure their heart rate again, the whole time either having a little pulse ox monitor on their finger. We've also talked about looking at lung function, so something as simple as blowing into a straw and moving a ball up and down. We're looking at building a physical activity module, working with an investigator from OHSU Cascade actually on this one, where we're looking at trying to implement a little module where kids kind of hook up to electrodes and they do specific tests to look at motor skills and they see themselves, but that whole time we're collecting data points from them, walking on the line or doing these kinds of things. And then we're also looking at adding a recruitment registry. So as one of the modules, people can actually sign up and say, I'd really love you to be able, to contact me if you're doing studies in the future on cardiovascular disease or, these kinds of things. And then we're hoping to be able to eventually be able to use some of the data that we're collecting to support policy and public health. There's constantly a need for baseline assessments, health assessments across communities, especially a lot of these rural communities where some of our national measures don't reflect the health of those areas very well. And they're being mandated right now at a state level to be able to demonstrate, what was your baseline need and how did the programs that you're implementing address those needs. So to keep their state level funding, they're needing to demonstrate, find out what is our base. And so we're hoping that we can begin to work at a policy level to begin to provide some of this data. And then I am right on time. And I just wanted to acknowledge kind of the crew that's been working on this. These are 3 key primary players. You saw Lisa in that first video. She's Associate Director for the program. Stefano Setola is our programmer extraordinaire, one of now a party of 5. And Adam Lippis is a research coordinator. He developed our whole online volunteer assessment system. We do have a number of advisory boards now. So we have a parent advisory board, a teacher advisory board, as well as a administrative kind of scientific advisory board that's helping us really think through kind of what is our long-term goals and how do we identify our populations of interest. Collaborating partners, many of them. And then all of our kind of amazing volunteers and participants. And these are some guys at the Grand Fair that were completing the sleep survey, and we're very excited to show us their wristbands. And then we're funded by the CTSA and the SEPA. Oh, I think that is it. And I have about 5 minutes for questions. Yeah.
So how are you working sustainability? Is it going to be sustained by grants?
Right now, it is sustained by grants, and we're working very hard actually to try and build in some base funding. We're looking at base funding from the state, and we're looking at base funding from the university. The difficult thing is OHSU is a medical institution, and this is classic public health outreach. So it's making the case that this is something very important to consider as maintaining as part of your base. And so we are looking towards, because as you saw, there were a lot more red dots on that map, places that were requesting the fares. We've got over 75 outstanding requests right now, and we come nowhere close to being able to get to all of those. And part of that's because, the grant funding goes as grant funding goes. And so you can only have as much as you can do. So yeah, we're looking at many foundations, a lot of different directions.
Do you have to have the subject sign an IRB?
They do not sign the consent form or anything. It's they get an information sheet because it's all anonymous. They get an information sheet that basically serves as their consent that tells them what we're doing. When they come to the entry booth to get their wristband, they're given the information sheet, and then a person goes over that with them, tells them this is research, and then when they first scan their wristband, they're asked, do you understand you are about to participate in a research study? And they have to say yes or no. And if they say no, then they're sent back to get their information sheet. Yeah. Yeah.
Are there any plans to make it a nationwide program?
Nationwide? We have this kind of long-term goal of what we're trying to do is make the modules so that they're much more self-sustainable. So we don't have to be there to help people pull up the programs and get the things running and get it linked to the data system. Once we get that fully functional, we want to make that online. Our really super long-term goal is that people could come onto our website, say, I'd like to host a fair, and actually download the individual components, and then we send them the wristbands and the pieces like the Tanita, so that they could actually, if they say, I want to hold a fair, I want to have 3 exhibits there, I want skin cancer, diet, and body composition, then they can download those pieces and we send them the pieces that they need. So at that point, then yeah, it could go anywhere. Would be nice. And then all the data would still come back to the single location. Yeah.
It really is a great, nice penetration for your program, Could you spend another minute or two, however you have, on the research side of it? I mean, it is so oriented towards how this is participation in research and things, and sort of what you see as the impactful outcomes or anticipated outcomes you see that would be the research component of it.
Yeah. So some of it's going to depend on who requests to use the data. So some very basic questions relate to particularly using the DNA data. So there's a lot of people that are interested in using the salivary samples. They want to look at population distribution of particular genes related to obesity. So that's one area. There's already an investigator that's looking at a NEAL1 mutation or something, and they want to look at that particular aspect of the data. There's other individuals that are very interested in looking at the cholesterol measures and linking information about cholesterol levels to some of the dietary data, to some of the body composition data. Honestly, it's cross-sectional and it's population-based. There's lots of it, but it's limited by the way it's collected. And so some of the best ways to use this, in my mind, are for pilot data, to support development of larger grants, preliminary data. It's great community-level data to support projects that they want to do, and then moving it more into the policy. But I think, the number of research questions are really only limited by the creativity of the investigator that wants to use the data. And right now we're in a sense open source. People come to us and say, you have information on sleep patterns and you have how people push buttons on a vigilance test and you have DNA. I'm really interested in asking a question about, do people with a morning sleep pattern and genotype X, do they perform better on a vigilance task? And they can ask those questions using this data. So I think there's a lot that can be done. It's really just getting the information out there and then helping people understand a little bit about what are some of the limitations to the data.
There's no other questions. Let's thank Dr. Shannon for her presentation.